Clinical Judgment, Week 8. This week we have a client who is a 55-year-old male admitted to the hospital reporting abdominal pain. This client has abdominal pain, a 6 out of 10, blood pressure 145/89. He's reporting slight shortness of breath. He has 3+ pitting edema to bilateral ankles. Lungs are clear to auscultation. Is reporting fatigue. Has a temp of 98.8 oral. Respiratory rate of 24. A large round abdomen. A history of excessive alcohol intake. Pale skin with a slightly yellow hue. Very itchy skin. And active bowel sounds times 4. So once again, we need to look at all of these assessment findings, normal and abnormal, and determine what is actually pertinent to this client at this point in time. This is what I've pulled out. Abdominal pain, 6 out of 10. Slight shortness of breath, the edema, the fatigue, the respiratory rate, the abdomen contours, history of alcohol intake, pale yellow skin, and itching. Well, if you recall, in some of those assessment findings, we did have other abnormals, and I didn't put those down here. But I didn't find them particularly pertinent to what is going on with this client. So let's look through these and determine potential causes or implications. So we have that abdominal pain, and it's pretty significant. 6 out of 10 is definitely something that we need to be addressing. So what could cause that? Maybe appendicitis, bowel obstruction, severe constipation can cause abdominal pain, gastroenteritis, cholecystitis, pancreatitis, liver disease. How about the complaint of slight shortness of breath? Well, he could have a respiratory infection. He could have a respiratory illness. Maybe exertion that just causes a slight shortness of breath. What about his large round abdomen? It's not allowing him to fully expand his lungs, so that can definitely cause some shortness of air. Let's look at the pitting edema. What causes edema? Well, first of all, we know there might have been some injury. Maybe he just has poor perfusion. Maybe there's peripheral vascular disease, fluid volume overload, congestive heart failure. How about that fatigue? Well, that could be a chronic fatigue disorder, where there's no real cause. Maybe it's obstructive sleep apnea because people who suffer from sleep apnea are fatigued. Maybe just not sleeping enough. Maybe it is overexertion. They're just working their body too hard and not getting enough rest. It could also be a symptom of a disease process or electrolyte imbalance. Elevated respiratory rate. Again, this might be a respiratory disease. It might be a respiratory illness. Maybe there's just some hypoxia or anemia, fluid volume overload, or what about fluid volume deficit? That large rounded abdomen, well, potentially obesity. If this were a female, maybe pregnancy, but not a female. Intestinal gas. And the big one, maybe ascites. A history of excessive alcohol intake. We know that this doesn't necessarily have a cause other than addiction, but it can mean that this client does have an addiction. And if there is an addiction, we could be having multiple days of excessive alcoholic intake. This causes liver disease. It could also cause pancreatitis. Pale skin with that slightly yellow hue. We know that there is most likely increased bilirubin in the body. It could mean that there's blocked biliary duct or pancreatitis or liver disease. What about someone who smokes way too much? Nicotine can start causing a yellow staining of the skin, especially around the nails. And skin that's very itchy. Well, one of the first things we think of with itchy skin is there's some type of a hypersensitive reaction or an allergic reaction, the contact dermatitis, for example. We also look at potentially maybe the skin is just really dry. They're not very well hydrated. But it could also be a buildup of toxins in the skin from liver disease or renal failure. Some potential complications with abdominal pain. Peritonitis is one of the big ones, having that inflammation of the lining of the abdominal cavity, potential infection can be very, very serious. That slight shortness of breath could potentially lead to respiratory, or could be a symptom of respiratory acidosis, or could lead to respiratory alkalosis. That edema, this could possibly be skin impairment. When the tissues are edematous, they become more fragile, and injury is very possible or very easy to occur. That elevated respiratory rate, again, it could be a cause or a symptom of respiratory acidosis, but could definitely lead to respiratory alkalosis. And if it is not corrected, eventually it could cause some respiratory failure. That large rounded abdomen complication would be ascites. History of excessive alcohol intake, again, liver damage or pancreatitis. That pale skin with a slightly yellow hue. Knowing what these are symptoms of, then we could look at potential liver or pancreas damage. And the skin being very itchy. People have a difficult time not scratching. They They want that relief from that discomfort and can potentially cause skin impairment. So, what do you think is going on with this client? Personally, I think this client has some type of liver disease or infection, such as hepatitis or cirrhosis, possibly leading to uh, liver damage and liver failure. But these symptoms could also potentially be from liver cancer. And the other issue would be the abdominal pain. So, what are the priorities for this client? The client has shortness of breath. That is definitely a priority. We need to address that. The pain and the potential liver issues. So we would expect there to be no shortness of air, minimal to no pain, and improvement or at least a maintenance of the liver function. So this time we're not going to look at healthcare members, but just be aware of who all is going to be involved and what duties they may have in the care of this client. So what would we not do? Again, as we have done previously, if they potentially have appendicitis, which we don't know until we rule it out, we need to minimize analgesics so potential rupture is not masked. We also need to be very cautious with the medications that we administer if we are suspecting liver issues, because the liver is going to metabolize the majority of the medications that we ingest or partake of. So, what would we do for this client? Well, let's start off by monitoring vital signs. We have that abdominal enlargement, so we probably want to monitor the client's weight for the simple fact that if he does have ascites, which symptoms kind of sound that way, we need to be monitoring what that fluid volume is. We also would want to measure the abdomen to see if the abdominal size is increasing. And remember, that's going to require using a tape measure along marks that have been made with a permanent marker on the client's skin, so we're measuring in the same place. We would also want to monitor the client's level of consciousness. If this is a liver issue, we know that ammonia buildup can cause that hepatic encephalopathy, so we want to monitor the client's LOC. We also want to monitor for signs of a GI bleed. Maybe that abdominal enlargement is due to hemorrhage within the abdominal area, and it's causing an expansion of the abdomen. We would definitely want to administer some analgesics, but we need to make sure that those are non-liver damaging analgesics. One of the most common analgesics that we have around that is toxic to the liver in overdoses is acetaminophen. How about some heat to the abdomen? If it's hurting, heat often feels very good. Definitely some lotions to the skin to help deal with that pruritus. Let's do some lab work. Let's get some liver enzymes. We know that with liver disease that increased ammonia levels are very, very important to keep track of. So we would definitely want to look at those ammonia levels. And we would also want to monitor the protein levels. We may need to administer some vitamins or nutritional supplements. No alcohol intake. And we may also need to restrict protein and sodium intake if their levels are too high. What about some potassium sparing diuretics? Again, measuring that abdominal girth and keeping track of that measurement would be so important. We may need to do a paracentesis to remove some of that fluid that may be building up in the abdomen, and what we call liver rest. In other words, minimal activity, minimal things that are going to stress the liver function. So, what do we prioritize? Again, we're looking at what is potentially limb or life threatening. We definitely need to prioritize that respiratory status. So, that means we're going to be monitoring our vital signs. Doing that paracentesis, let's remove some of that abdominal pressure to allow those lungs to expand more easily. Restricting sodium, because remember, water follows sodium, and if we have a buildup of fluid in the abdomen, we may need to restrict the intake of items that's going to potentially cause a further buildup. And diuretics that may help relieve some of that fluid buildup. With the pain, we definitely need to give analgesics, and to improve or maintain liver function, we need to make sure all of our medications are non-liver damaging, that we're not administering alcohol, and we are encouraging the liver rest. So, did we meet our expected outcomes? Did we achieve those goals? If we did not, what do we need to change? Time for the priority client. Is our priority client the client we need to take care of first? The client with a postoperative bowel resection who has an ostomy and an air-filled appliance. A client with an NG tube suctioning moderate amounts of dark green drainage. A client who has an acute episode of nausea vomiting with coffee ground emesis. Or is it the client with an acute episode of nausea vomiting with undigested food and medications? Well, let's look at each one of these. The client with the air-filled appliance, with the ostomy, well, we just really need to burp that, but is it an emergency? Not really. The NG tube that's suctioning moderate amounts of dark green drainage. Well, we put an NG tube down. That's the drainage we expect to see. A small to moderate amount would be very expected. The nausea vomiting with coffee ground emesis. Well, what would coffee ground emesis indicate? Potential bleeding going on somewhere in the gut. Or the client that has nausea vomiting with undigested food and medications in the emesis. Well, the first time a client does have nausea vomiting, we often will see undigested food and medications. Not uncommon whatsoever. So, the coffee ground emesis, we potentially have a bleed going on somewhere, and we need to determine how significant this bleed is because they could hemorrhage. Number 3. All right, so now we have a nurse teaching a client about being discharged, who's being discharged, about taking prescribed medications that include sulcrafate. What statement by the client indicates teaching has been effective? So, what is this question asking? First of all, we're saying that teaching has been effective. So, that means we're looking for a statement by the client that is correct, a statement that is something we want to see. Otherwise, you know, what is the indication for sulcrafate? Is it the main side effect of sulcrafate is diarrhea? Is it I will take sulcrafate with meals? Is it I will take sulcrafate along with my antacid medications I take? Or is it sulcrafate works to heal my ulcer? Excuse me. Correct answer, number 4. Next question. We have a client with a gastric ulcer who suddenly develops sharp, constant epigastric pain that spreads out over the entire abdomen. What complication has the client most likely developed? Okay, what is this question asking? First of all, we need to know what complications of those ulcers are and what one of those complications would cause sharp, constant pain. Would it be hemorrhage, gastric erosion, perforation, or gastric cancer? That sharp pain, especially if it's sudden pain, perforation. Next question. Our nurse is assessing a client who has acute cholecystitis, whose abdominal pain is severe. The client is pale, diaphoretic, and describes extreme fatigue. We have a heart rate of 118, a blood pressure of 95/70, a respiratory rate of 32, and a temp of 101. What is the priority action at this time? So, what is this question asking? It tells you, first of all, that this is a priority question. So, the first thing we need to ask ourselves is if I don't do this right now, something bad will happen to my client. Excuse me. Is it instruct the UAP to reposition the client for comfort, auscultate the client's abdomen in all 4 quadrants, notify the client's healthcare provider, or administer the ordered opioid analgesic? Let's look back at this question. We have a client who is pale, they're diaphoretic, extreme fatigue. My vital signs are all out of whack. This client is really pretty sick. I want my healthcare provider to be aware of what's going on so I can get appropriate interventions implemented. The nurse is teaching a client with cirrhosis about lactulose therapy. Which statement by the client indicates the teaching has been effective? So once again, what is this question asking? Well, we're looking for effective teaching, so we're looking for a statement that the client has made that is correct about lactulose therapy. Is it, this therapy will promote the removal of ammonia in my stool? Is it, constipation is a frequent side effect of this therapy? Is it, I will know the therapy is working when I'm less itchy? Or is it, the drug tastes bitter and is watery? Well, we know lactulose is going to work as a laxative. So number 2 is not going to be correct. We also know that it is going to bind with the ammonia in the body to help the body excrete excess ammonia. Correct answer, number 1.